So I was asked the other day, Doc, what do you think about digestion? And, where do you go with it? And why did you choose that for your career? And it's funny, when you look at digestive disorders, first off, what are they, right? How do you know if you even have one? And one of my mentors, Howard Loomis, and I've taught for him for a number of years now, Howard always said there's certain things you look for. And this is, if you can recognize when the body needs change, especially dietary modification, you can perform miracles. And so that's what we do. So if you have stiff, sore, achy joints, if you ever get headaches anywhere, heartburn, gas pain, bloating, constipation, diarrhea, maybe anxiety or irritability, some restlessness when you sleep at night, or you have insomnia, you can't sleep, or depression. Those are all symptoms of the body telling you, look, I need change. I'm in trouble. And that's where dietary modification comes in, because those are all the core foundation things we look for in practice with a patient when they first come in to see us. Do you have any gas pain? Do you have any bloating? Have you had trouble with heartburn? Are you getting headaches all the time? I know the body's telling you, look, I can't do this. Now, what's interesting about the body, you have a musculoskeletal system. It's muscles and bones and all those good things. But you've also got organs. There's an internal system that's going on. When they teach classes in colleges, they teach anatomy, which is the muscles and the bones, and physiology, how it all works. So when you're talking about dietary modification or the need for it, you're looking at the physiology. We're going above and beyond the anatomy at this point. We're saying, Mrs. Smith, you've had your headaches now for a decade. You've seen chiropractors, you've been to physical therapists, you've had injections and shots, you're on medications, and you still have the problem because they've not found the cause. And so I got into digestive work looking for that answer. I had patients that were struggling. I saw patients when I was in clinic during school that I noticed, they're not getting any better. They're seeing the same person. You're walking in, having the same treatment done year after year, or their disease or their condition was progressing and just gradually getting worse. We're barking up the wrong tree. And so I started getting the digestive work. And I thought to myself, all right, so what would happen if the body went after parts, but it couldn't get them? What if you gave the body the perfect diet, but it couldn't use it? It couldn't break it down properly. It couldn't absorb that food. Well, then how does it ever heal and repair? It doesn't. And now that's what leads to all the symptoms. You don't get heartburn first and then develop a digestive problem. It comes on as a result of what's wrong. So it always intrigued me. And I'd look at it and say, well, how complex is it? Really, how many food groups are there? Protein, carbohydrates, and fat. So all I have to do is recognize the symptoms of those being out of balance. If you're missing some, if you're deficient, or you're not utilizing them. So look at protein. You see cold hands and feet. Boy, that's a big one. You see any kind of cramping in muscles and muscle tissue, or excessive wetness in the body, runny nose, runny eyes, you spit when you talk, that mouth thing, right? It's protein. Well, I thought, well, carbohydrates have to have something as well. Well, they do. They go the other way. You get dry, trouble concentrating. You can't stay focused. You forget things all the time. Your muscles get weak. You notice that you're tired a lot. You have a fatigue issue going on. Well, once I figured out protein and carbohydrates, the only thing left was fat. And I thought, well, what do we use that for? Oh, dry skin, tremors for no reason, blood pressure issues, trouble having pain under control, chronic pain, especially in joints, followed fat. And the big one for me was fertility. All the female and male hormonal problems. So digestion opened that window for me. It gave me a view into, if I could understand that, and I could learn how to correct that, then all I had to do was recognize it. And those initial symptoms, the stiff sore joints, the headaches, the heartburn, the gas pain, the bloating, constipation, diarrhea, the anxieties, the depressions, the irritabilities, the insomnia, those all told me this body needs more help. It needs more than what it's getting. It's that simple. You restore normal function and you can perform miracles. Dr. McCaffrey.